All right. Welcome, everyone. Thank you for spending your valuable time with us here today. I'm extremely excited about today's presentation, so I'm going to speed through my usual spiel. First, please take full advantage of the live webinar format and our subject matter expert. I encourage you to submit your questions along the way for the Q&A session at the end in our questions panel. They're anonymous, and likely if you have a question, there are probably 3 other people that have it too, but won't ask it. So please be the brave one and ask away. It really enriches these presentations. Second, of course, all attendees are muted, but if you need to communicate with our engineer, Isaac, about technical issues, feel free to use the chat panel, and he might have some tips for you. Again, that's the questions panel for questions for the Q&A and the chat panel for technical tips. Now, if we do have technical difficulties today, it shouldn't take us more than about a minute or so to come back up. But if you have to drop off for that or any other reason, remember the webinar is being recorded and all registrants will receive a link to that recording in our follow-up email on Friday. And also a link to the slide deck and contact details for today's guest presenter in case you have additional questions. Now, for those of you who don't know, my name is Tony Huth. I'm the CEO and co-founder of Medicom Health. We're best known for our popular line of health risk assessments, HRAs, used by over, I think, 1,100 hospitals today for digital consumer engagement and service line growth. They really allow your patients and prospects to quickly and easily pursue concerns they have around a specific health condition right on your website and understand the best next steps for their situation. And honestly, that's a digital convenience that modern healthcare consumers expect and that you need to provide, especially if you're going to compete with the Apples and the Amazons and the Googles like we're talking about here today. And in return, you get a wealth of data that you can use to fuel your personalized nurturing to deepen those digital relationships. So if you haven't had a recent walkthrough of our management portal, especially, that's the back end of our HRA solution, not the quiz component, please contact us and request one. That's where the real MarTech power lies, and we're constantly adding features and integrations to expand the value and the functionality. All right, on to the main event. We are fortunate to have with us today our guest presenter, Annie Haarmann, the head of strategy and consulting for healthcare and life sciences at Reputation. In her current position, Annie partners with organizations to provide strategic consulting and data-driven insights to maximize value, drive acquisition, and improve consumer experience. Prior to her current role, Annie directed enterprise strategy for online consumer experience at Ascension, where she launched the organization's first national integrated consumer web platform, managed online reputation for thousands of locations and providers, and drove innovative strategies to support growth and improve consumer access and experience. Annie is a Coral Leadership Program graduate, a recipient of multiple national Marcom Awards, and a past St. Louis Business Journal 30 Under 30 honoree. Now, as an aside, I can say that Annie literally knocked my socks off within about 10 minutes of talking to her about this subject, and I basically made her commit to a webinar on the spot. So I'm really excited about today's presentation. And with that, I'll get out of the way and turn it over to Annie.
Wow, that's the best introduction I think anyone's ever given me. Thank you for that. I really am flattered to be speaking with this group today. And thank you to the Medicom team for inviting us to share some of this information. And I think there's a lot of synergies, as Tony said, with what we're going to be talking about and that Google patient journey and what you're trying to deliver with these health risk assessments that are really going to drive those qualified leads into your system. So let's get started here. I want to start by kind of a high-level overview of what we're going to be covering. Why it is that we're talking about this, that Google is really aiming to be the single point for all consumer conversion that is occurring on the web, why Google mobile buttons are now really important to pay attention to, and some changes that have come recently to that experience, and what you need to do to optimize your landing pages so that you are able to be found in this changing journey and within changing expectations for consumers. So let's start with, what is online reputation? Well, online reputation is all about being highly visible online, maximizing your local search optimization, and improving the experience for consumers. And reputation is extremely important to healthcare consumers. We do our annual healthcare reputation report, and it's a very robust report that includes a third-party survey of healthcare consumers nationwide, as well as an analysis of more than 300,000 locations and physicians' ratings and reviews. So from this report, we know that the vast majority of consumers trust online reviews. They want their doctor that they choose to be 4 out of 5 stars or higher. And ratings and reviews are the third most important decision factor for patients after insurance and location. Now, this one's important because this is especially true for millennials, who are much less brand loyal than the boomer generation that came before them. And of course, Google is the #1 review site used by healthcare consumers. This stat is backed up by both what our consumer study showed us, as well as the volume of reviews and traffic to Google My Business. This is all really important because we live in this feedback economy now. Anybody can research anything before making a purchase decision. And these third-party ratings and reviews are influencing everything, whether it's the shoes that you're shopping for on Amazon to the new restaurant in your neighborhood. You want to find good experiences, you want to see feedback from others, and that's how you're making a decision. And this is now the expectation for healthcare as well. And there was no clearer illustration of this than something that happened over the summer. And it was very interesting to watch the Google search trends around vaccines. And one of the things that we observed, and this is all available through Google Trends, you can see all of these reports online, but when you looked at the top 25 searches related to vaccines, almost half of those were comparison shopping searches. So things like, which is better, Pfizer or Moderna? Which vaccine should I get? What are the pros and cons of the Pfizer, Moderna, Johnson & Johnson? People were looking for the brand of the vaccine and comparison shopping them. This is a behavior that, a few years ago, we could have never predicted. When you think about flu shots, we get those every year. When was the last time you Googled the brand of flu shot before you made a decision about which flu shot to get? You just wouldn't. And now, because of where we are in the information that is available, consumers are using that information to make decisions. And that's why it's so important to optimize your presence on Google when and where they are searching. So Google has certain factors that they weight more heavily than others when it comes to organic search. And what's really important to see here is the top 2 are Google My Business. That one is the biggest heavily weighted factor. And then the second one is reviews. So you can see how Google is starting to look at that consumer experience and try to own that. They want Google My Business to have as much information as possible, and they want that third-party feedback. The on-page behavior is still really, really important at 15% of weighting. And that includes things like, the actions that they're taking on your landing page, such as HRAs, for example. So this is where the rubber really hits the road when we're talking about consumer search in healthcare. And I want to point out that whenever I do a slide like this where I show the steps of a search in a journey, I always try to get it to be as up to date as possible. This search that you see here was done at about 9 o'clock this morning, Central Time. So this is real-time data. And what you see here is that Google is now starting to prioritize search results that are around symptomatic search. So 80% of healthcare search on Google is symptomatic search. So this means, for example, I type in, what does a hernia feel like? And this, I came up with this search because I started typing in, what does a, and this was one of the options that came up. So clearly there is some search volume around this. What does a hernia feel like? And it immediately, when I enter that, it takes me not to a list of search results. It takes me to this entry for hernia, where Google has already used structured data to organize it into symptoms, treatments, and specialists. It starts at defaults at symptoms because it knows that this is a symptomatic search. And as you can see, it's going to show me some of my symptoms. Swelling, pain, in the abdomen, can be dull, abdominal discomfort. These are all terms that are going to come up in symptomatic search. When I click on that next button, the treatments button, it's going to include the treatment options here. And as you can see, there's supportive care, surgery, devices, and you can go through those and get more information. If I go to this next button, when I click on specialists, that first option here is primary care provider. The second option is surgeon. I clicked on primary care provider and look what it shows me. It shows me the primary care providers nearest to me that are open right now, that are top rated, and accept Medicare. As you can see, this is the default. The only thing I typed in was primary care provider near me. Actually, I didn't type that in. I just clicked on specialists. This is what shows up, and it defaults to accepts Medicare, open now, top rated. Now, if I click on more filters, I can start to see more results and organize it in a different way. But as you can see from these results, that top listing for a family practice physician, Dr. Solansky, she has 134 online reviews. She has a 4.9 star average. Obviously, she's doing really well. Google sees that this is valuable information. They also see that she offers virtual care, so they've got the little online care icon there as well, and she's showing up top. This is the consumer search journey. So what happens is, right here, I've gone through each of these steps. I'm narrowing down my focus. I'm moving down the funnel, and I still haven't even gotten to your website. Here's what happens next. Google loves Google. Google loves its own products, and their goal is to keep you using Google products, to keep the consumer in the Google experience. So when I click on Dr. Solansky, I see this knowledge panel of information about her. I see all of these options where I can convert. There are certain actions I can take. I can book an appointment online. I can start a virtual care visit. I can look at the insurance accepted. I could send a message. Messaging is now growing in Google My Business. I can look at Q&A. I can ask a question and wait for it to be answered. I could answer a question someone else asked. There's all of these different interaction points beyond just the basic, here's the address and phone number. Google really wants to own the entire conversion journey, all the way to the point of the feedback after the experience. So as you can see here, this is just a review I pulled up. It was a recent one. I really liked it because it had to do with kicking a nicotine habit, which I think is really positive. This particular patient, they posted this review, and the brand, Baycare, they responded. They said, thanks for sharing this. We are really happy about your experience, and we'll be sure to share this with the team. So not only are they getting positive feedback, they're engaging with that feedback, which helps to improve their reputation score and visibility on Google overall. But not only that, that feedback then becomes part of this loop that gets created where you have a satisfied customer endorsing that brand that then shows up in that knowledge panel for future consumers to see and convert. You know, you saw that Dr. Solansky is showing up at the top because she's got so many reviews. And, you know, she's only got a 4.9 compared to the next one on the list that has a 5.0, but she has 134 reviews, which Google says is much more important than just these 8 reviews of the next one down. So you can see how not only the ratings, but the volume of reviews becomes really important. So where do we start? Obviously, there's a lot here, and you could spend all day, every day, just optimizing your Google presence. But we want to make sure that this is tangible and that you can build a program that works for you. There are all of these different points that you want to own in the Google search experience. And this is a slide where, you know, I hate using desktop view because it's not the reality anymore for most consumers. But when it comes to showing all of these different points, it's the only view that we can get everything onto one page. There are Google ads. There's these dynamic landing pages, your landing pages, the pages that you have embedded your HRAs on.
So it starts with the data, and unfortunately, it's the challenging work of all of this, but it is really foundational. You need to have a source of truth that's going to feed the directory of data around your locations and providers. Now, the source of truth can be anything. It might be a credentialing system or an Excel file or an EHR or a CRM, whatever the case may be. You want to feed all of that into a single directory that is built to amplify this data across the web. And what I mean by this is, if you click to the next slide here, what I mean by this is you want to be able to take that data and repurpose it at scale for your marketing efforts. If you could click to the next slide, please. There we go. So there are a lot of different ways that this data comes into play. One option is your find a doc. So your location directory, making sure that on your website you have really good structured data, that the schema is set to appropriately be organized by Google to match the right patient with the right doctor at the right time. The other way to use this directory data that you would manage at scale is to drive people to landing pages. So for example, you've got this beautiful landing page that you created. Maybe you've dropped in an HRA, you've got some specialties listed, maybe some great promotional videos, but how do you make sure that those patients can actually convert with providers that have availability and providers that are part of that specialty? Well, the old way used to be that we'd run a campaign and we'd send them to our provider directory, or we'd send them to our website and they'd have to look around and find a doctor that met their needs. What we can do now is we can start to get really granular and drive the volumes to the right groups of providers. So maybe in your data management system, you want to have a key tag that you can check off for providers who have recently been onboarded and need to fill up their schedules. That could be something that gets built into the workflow, that they get added to a group that shows up on landing pages so that you're driving volumes to those providers versus leaving it up to chance or setting it up alphabetically so that the Dr. Adams gets all of the leads and Dr. Zelensky gets none. So that's really important for landing pages. And then the third piece of this, if you click to the next step here, is amplifying this data across all of the third-party sites. This is what local SEO is all about. You can't count on consumers going to your website. The idea of branded search is much diminished now in the feedback economy, where consumers are searching for convenience, proximity, and sentiment. So you want to make sure that on all of your third-party listings like Google My Business, WebMD, Vitals, whatever, that you have optimized your data, and that when a new provider gets onboarded or you have to change the hours for a location because you have, COVID that, it's restricting hours or something, you can make that change in one place. And that one place becomes your directory. You may not have all of your information around hours of operation or photos or anything in your source of truth. Ideally, you do. But if you don't, you can manage all of that in your directory and have it feed out to all of these pages so that you're only making the update one time and not multiple times across many, many sites. So this next slide is going to talk about what happens once you have all of your data organized. Is you can start to use it in ways that are going to drive more visibility to your listings and drive higher conversions. So one of those ways is review requesting. Review requesting is so important because Google has continued to emphasize the importance of third-party feedback in the consumer journey. So the more feedback you have, the more likely you are to show up on Google. That feedback is in the form of ratings and reviews. And we're not talking about CAP. Those are a different type of feedback. They're important, but that's considered first-party feedback. And Google is only going to organize and rank third-party feedback. If you click to the next step here, please, this is what happens when you start requesting reviews. You end up with an amazing increase in positive sentiment. You start driving a huge volume of online reviews, and you start to see more conversions happening on your site. So, for example, in this case, we have a case study of a client of ours that did review requesting. And as you can see from when they turned it on, they immediately started having incredible returns on this strategy. They started to have an increase in their reputation score. They increased their calls. A lot of those calls are new appointments, increased it by 183%. And they doubled their views. And when you go to the next step here, please, you can see that the ROI here is 691%. So if I were to tell you, hey, we could do one thing, one tactic, turn it on, and you would be able to increase your ROI by nearly 700%, it would be a no-brainer, right? That's what review requesting does. If you go on to the next slide, please, and Tony or Isaac, can you confirm that you can still hear me?
Loud and clear.
Yes, we can still hear you.
Perfect. Just to let everybody know, my computer has completely crashed now, and I am going off of memory. I don't have a computer in front of me anymore. So this is going to be really fun, and I appreciate everyone's patience. The next step
Annie,
of
this is Transactional CX.
Got it. Thank you. So the next step of this is Transactional CX and showing up when and where patients are searching for care, connecting the right patient to the right provider, making it easy for patients to select you for care, and using reviews to generate future patient acquisition. Now, the way to do this is to think about all of those touch points in your consumer journey, understanding what patients need, when they need it, and delivering that. So, a consumer is looking for things like, what's the right care for me? How can I communicate with my doctor? How do I schedule an appointment? I want to pay a bill. I want to order refills on my prescriptions. All of these are transactions that are really important to optimize within this overall journey. So once they land on your page, make sure that there are many ways for them to convert and transact with your brand, so that it's not just a landing page that gives them information and doesn't take them to that next step. If you go to the next slide, please. Here we start to look at how you can build toward a better experience. It all starts with table stakes, of course. And table stakes in healthcare is listening. You want to listen to what consumers are saying. You want to collect all of that feedback that you can, whether it's through social, online ratings and reviews, surveys, your call center, your employee surveys, any types of feedback. You want to start listening to that and be able to identify areas where you can do service recovery. Maybe there's a patient who had a problem paying their bill and they send a message through Facebook Messenger. Or maybe a candidate had an issue with applying for a job and they go right to Google and send it through send it through Google Messages. Or what happens when someone posts a question about some kind of diagnostic, and that goes right into Q&A. If you're just letting those types of inquiries just exist out there and not doing service recovery, then you're missing out on a huge opportunity. One of our clients recently shared with us that because of their service recovery program, they are able to, in real time, save members and keep them within their organization. So just for example, they had someone who got very frustrated about an experience they had in one of their physician offices. They left, and within an hour, they had received a survey asking them for feedback on their experience. And of course, they shared, I was really disappointed because I felt very uncomfortable in the building. There was no social distancing in effect. The chairs were all next to each other. I couldn't get away from, other patients that were in the waiting room. Some of them weren't wearing masks. It wasn't clear whether there was, disinfecting measures being taken or not, and I just didn't feel safe. Well, they took that feedback, and within hours, they had responded to this person saying, "Thank you so much for sharing this with us. We have followed up with the clinic manager, and we have a plan to remove some of the chairs. We're going to spread things out. We do deep cleaning procedures every couple of hours. Everyone should be wearing masks, so we're going to add new signage to make sure that people know when they come in." And basically, they addressed all of her concerns. Well, this member was so happy about this that she went out of her way to then go out on Google and posted a review that said, "I will be a member of this health plan for life," because they cared enough to listen to my feedback. This is the bare minimum of what you should be doing when it comes to that consumer experience along that journey. The next step, if you go to the next piece of this, is acting on that feedback. So how can you take everything at scale? It's no longer just about that one experience that someone had and resolving it for them in real time. It becomes all about collecting as much data as possible and analyzing it so that you can make overall operational improvements to the entire delivery. So things like when I start to notice trends that wait time complaints are going up, or that sentiment around billing and affordability is going down, I can start to see this is a trend I need to look into. We had a client recently who told us that they were monitoring all of their online reputation, and they look at sentiment, they look at the different categories, and they noticed that one of their locations, all of a sudden, they saw a big downturn in the feedback that they had around nursing staff. And normally, that was an area that they got stellar remarks around. It was always in the green. They always had a lot of comments around it. But all of a sudden, this started going down. Well, they were able to pull a report, reach out to the leader at that location and say, "Hey, this is what we're seeing in the feedback. This is what people are saying about us on Google, about this location. This is going to start impacting our Google visibility in SEO. Can you tell us what's going on here? Well, they investigated it, and it turned out they had some nurse turnover recently. They needed to do some retraining of the new nursing staff, and within a couple of months, they had improved the sentiment around the staff. And not only that, when they turned on review requesting, all of a sudden it was like pouring on the gasoline, and they really got a whole lot of momentum around their Google visibility because they had so many more reviews. And the more reviews you can get, the higher you're going to be visible in Google. Finally, the third piece of building this better experience is winning. How do we get to winning? Well, this is all about just completely reimagining what that experience could be. Don't be limited by what you have today. Think about what you aspire to deliver to consumers and start aiming toward the metrics that are going to deliver on that. So what are the key performance indicators that are going to tell you that you are delivering a good experience? Whether it's, star rating around a particular service line or sentiment around a particular insight category, you want to be able to reimagine what it should be and use the feedback to make that possible. So we'll go into this next slide, and I think it's really important to give you some high-level key takeaways if you are going to embark upon improving the digital experience, the Google journey, being found where you need to be, and improving the consumer experience overall. First, as I mentioned, start with the data. This is foundational. If you can, you should automate it. We have a lot of clients who, they're not able to connect to our API yet because maybe they're managing that data manually. We can certainly do that for them, but it becomes more of a challenge if you have anything that can be automated, even if you're only automating the specialties or the contact information, and then you're manually managing things like photos and bios. You're at least taking some of that and making it efficient and taking that weight off of your marketing team to manage that data. Secondly, document your ideal state. So, we've all heard about this, those of us who are part of the generation whose parents told them you can do anything. We know that it's important to sort of be visionary. I think Oprah is the one who taught us all about vision boards. You've got to document this, and you have to have a bullseye that you can target, because without this, you're just going to keep spinning your wheels and you won't have a place to aim your effort. Everything that you do should roll up to that overall goal. What is success going to look like for you? And how are you going to measure it? That will dictate all of those iterative steps that you take to get there. The next step is to fail. I remember when I first learned about embracing failure, I thought it was a total crock, and that it was, just some jargon that was used in Silicon Valley. And it can be, but in this case, what I mean is don't be afraid to take risks and make mistakes. You're not going to be able to launch a fully robust program with all of the different elements working and firing on all cylinders tomorrow. It's just not possible. But what you can do, if you've documented what your vision is going to be, is start looking at individual pieces. So for example, Google just rolled out their ability to show insurance accepted on all Google My Business listings for healthcare. They've scraped this data from third-party sources. So if you're not managing this actively, Google is going to do it for you. And Google is basically sending the message that we want all of this information in here, and it's at your own peril. If you don't manage it, we will. So that could be a first step. If you haven't looked and tried to find what are the insurances that are listed there, to make sure that when someone is searching accepts Medicare near me, you are showing up. And that's really important. If you haven't done that already, start doing that. Another way to look at, iterative approaches is your Q&A. Take a step to look through your Q&A, try to engage there, and if you haven't already, respond to the questions that are out there and start feeding your own questions. If something doesn't seem to be working, move on to the next tactic. There are plenty of ways to engage on Google My Business, plenty of ways to engage in other digital channels. And so you shouldn't just keep throwing more and more time and energy around something if it isn't delivering on the KPIs that you have decided are important to you. Challenge your partners. This one's really, really important. And I learned this lesson when I was on the provider side. I managed a portfolio of digital technology, from content management systems to reputation management, SEO, digital advertising, all of these different tools that kind of make up the marketing tech stack. Well, at some point, you're going to come across a challenge that you can't solve yourself. And your partners, if they are truly a partner and not just a vendor, they are going to want to help you solve those problems. There is nothing I get more excited about than when a client contacts me and says, hey, this is something we're trying to do. Can you do that? And I say, we could probably do half of what you're asking for, but who are the other players? Let's talk to them. Let's talk to your CMS vendor. Let's talk to your EMR. Let's talk to the teams that are managing these other areas and create a really well integrated and seamless consumer journey. And if they're a real partner and not just a vendor, they will want to do this with you because they want you to be successful too. If you go to the next slide, here's my quick plug for Reputation before we open it up to Q&A. We are the leading experience partner for healthcare. We're trusted by the major brands. We work with the majority of the top 15 healthcare systems by Reputation. We also are ranked as a leader in the Forrester Wave and G2 Crowd and other third parties that have recognized that our company and our software and what we provide is of immense value. We also partner with a lot of other companies, a lot of other technologies. We are the only experience management partner that is part of Google's elite ecosystem of Google Cloud Marketplace. This is a special level of partnership that most software companies never make it to, and we are in that group, and so we're really proud of that. We have a really great relationship with Google. They've shared with us that we send more business listings data through to their API than any other software company that they work with. So we certainly have a presence there. And when it comes to healthcare, that's really important because as things change, for example, when the pandemic began and we needed to deliver a way for our healthcare systems to provide virtual care to people who are stuck at home, we worked with the Google My Business product team to make those enhancements, to improve the way that that data is shared across Google My Business for healthcare. Because as we all know, healthcare is not the same as a restaurant, and you can't treat the Google My Business listings the same way. And finally, I think that we could open it up to some Q&A here. I think that would be a good use of the rest of the time. If you can still hear me.
I can still hear you, Annie. Thank you so much. That was a great recovery. I'm going to tee up some questions here, but first, a quick reminder for folks, please watch your inbox for our follow-up email that will have links to this deck, to the recording, and as well as links to past webinar recordings. So here's a question actually, Annie, that came in early in the presentation. Any suggestions on how to track questions asked on one of our docs GMV profiles? We have 100 docs and there are no alerts or dates, so we have no idea when the questions were asked.
Can you start with the beginning of that question again?
Absolutely. Any suggestion on how to track those questions that you showed can come in on the Google Knowledge panel for a doctor. For example, if they have 100 doctors and they aren't seeing alerts or dates on those questions, they're not sure exactly how and where to respond.
Got it. Okay. Sorry, I was thinking there were 100 questions on one provider, and that would be probably something different. So the best way to do this is, and I hate to turn this into a sales pitch, but you've got to get a partner. You've got to get a partner that can manage this for you, pull it all into a single dashboard. One of the things that we do for clients is, we create, we have Q&A, and the way that Q&A works is you can either pull all of your Q&A from Google into a single dashboard and respond to them, find those questions and respond to them at scale, or you can feed your own questions across multiple locations. So maybe there is one question that comes up all the time and it's the same for 100 of your locations. Well, you don't want to have to go into Google 100 different times for 100 different locations and post that same question. You can use a tool that will aggregate that and push it out to all of your Google listings, and then take it a step further. And, at least in our case, you can take that Q&A and pull a little snippet of code. I would think it's not unlike what you do with Metacom for HRAs to drop into a landing page. You can drop Q&A into a landing page. So we have these widgets that you can drop in on your campaign page and show the Q&A that you want to provide. So I would say it's a two-part strategy. Number one, have it in some sort of platform that you can feed it all in and look at it all in a single dashboard. Otherwise, it's truly just a grind of going one by one by one through Google. And then two would be to get ahead of it. So proactively manage the Q&A with the questions and answers that are going to come up based on your experience, so that you can head those off. And if you have that Q&A that you're feeding to Google and to your other pages, then the answers will already be there and consumers won't have to post those questions.
Here's another question that came in. If Google's trying to steal my web traffic anyway, then how important is it to keep investing in my website SEO?
Yes, this question comes up a lot. And the truth is both are important for different reasons. So your on-page website SEO is important for the engagement and the consumer journey and taking them down the consideration path. Where your Google presence comes into play is it's really around those right away convert from the moment that they land on that knowledge panel. It's because they have a need and they're trying to solve for it. So if I'm driving down the highway and I see a billboard for ABC Healthcare, I may or may not need care in that moment. So I may or may not later Google ABC Healthcare or go to the ABC Healthcare website and look through the content. But if I'm at home and I trip and sprain my ankle, I'm going to Google urgent care near me, and I'm a much more qualified lead at that moment than when I'm driving down the highway, because I'm actually looking for care and I'm ready to convert. And that's the difference, because the SEO on your website should really help to drive more of those longer term decisions So things around, more of your specialty service lines like cardiology or oncology. Ones where a consumer is really going to be doing a lot of research and making a decision, whereas Google is all about, I need the care right now, I need to schedule an appointment right now, or I'm looking for a second opinion because someone has referred me to a doctor and I want to see what their ratings and reviews are. So it's really all about the moment in that search that that consumer is experiencing, and the on-page SEO is very important, and you should continue to optimize that. And most importantly, I would say in the last 5 years, the most important thing that has come out related to your on-site SEO is schema. And if your schema is not correct, especially on your provider pages, your location pages, you are going to struggle. You really want those locations and providers to show up in organic search, and the only way to do that is through schema that is going to organize that data in the right way. You got to be able to categorize it with Google.
Annie, this is an interesting question. Is there anything Reputation can do to help improve ratings on Glassdoor or other quote-unquote employee review sites? And I would think that would mean anything that anyone can do, but especially where Reputation can help.
Yes, absolutely. That's a huge part of our business. Especially when it comes to industries like healthcare, where you want that employer brand is just as important as the consumer brand. And when you've got such a shortage of nursing and clinical staff, you've got to fill those roles, and those candidates are searching you just like everybody else is. And so we have the ability to pull in employer sites like Glassdoor to give you the opportunity to request feedback from your own existing employees, so you can look at that employee experience, find ways of improvement, employee pulse surveys, candidate surveys, after they've applied, what was their experience going through that tracking process, and then optimizing that presence on those third-party sites. So yes, absolutely, I would look at employer third-party sites as every bit as important as the healthcare specific sites like WebMD and Vitals and whatnot.
All right, and one last question here. What is the best way to convince leaders that Google My Business is a priority?
The best way to do that would be to, first of all, show, a lot of times what happens with providers is they have this misconception around what the consumer behavior is, because they're used to their own behavior as clinicians or business leaders. And so I'll give you a great example. I was once giving a presentation to some cardiology leaders in a center of excellence within an organization, and I explained local search and the online reputation management program and how we were going to optimize for search. And the first question I got was from a very challenging cardiologist who said, well, obviously you're not doing a very good job, because I just Googled heart attack and I didn't come up in search, and I'm a cardiologist. So, how is that possible? And, I had to explain that that is not a search that a consumer might be doing in that case. Maybe they're Googling symptoms of a heart attack, or what does a heart attack feel like? And then the next step is they get to, the treatments, and, likely Google is going to say, go to the ER. They show up at the ER. They get their treatment there. Or maybe they already have been diagnosed with some sort of heart problem like, AFib or whatever, and they've gotten a referral to a cardiologist, a specialist. and they're going to go out and Google that cardiologist's name to see what their reputation is. Or another scenario might be that they've been diagnosed and they want a second opinion about something. So when it comes to online search, it's really important to think about those consumer journeys. Think about the way that a consumer accesses care. Is it something that is very much a self-refer in the moment type of conversion, or is it something that is more of a longer term, researching, making a decision type of conversion? A great example of that would be something like bariatrics. You're going to have a lot of research done around that, whereas something like urgent care is, whatever's closest by and has good ratings, that's where I'm going to go. So when you are putting together a program like this, to share with your leaders, make sure that they understand it's not about what they think the reputation is. It's really about what the consumer thinks the reputation is. And it's not about, going to the homepage of the website and being able to find them as a provider. It's about that first step that consumer will take, which is to do an online search. And so I would challenge your leaders to think like consumers and even show them some examples of typical paths that would be taken for your specialty service lines and other areas of care.
All right, looks like it is time for us to wrap things up. Once again, my thanks to Annie Haarmann from Reputation. Annie, any parting comments here?
I just want to apologize for the technical difficulties and I'm gonna have to get a new computer. It completely crashed midway. Medicom has broken my device, so so I apologize for the technical difficulties, but thank you for those who stayed on through the end. Really appreciate it.
We've been getting encouraging comments along the way, and another one just came in that said this was amazing, and I think it was. I'm sure we'll have more to reprise in a similar webinar next year. I think there's so much here to dig into, and I think this
Did
is
anyone
so.
post? Did you try unplugging it and plugging it back in again? Because that feels like what would be the response, but I haven't tried that yet. That'll be my next step.
No, but more thank yous are coming in, lots of great information, etc. So thank you again, Annie. Thank you again, attendees, for your time today. Watch your inbox for emails that'll have the links to that recording, the presentation, etc. By the way, next month's health marketing webinar, our guest presenter is Revive Health. We're still narrowing the topic down for that, so watch your inbox for those emails that will come in when the sign up is available. That's it, folks. Thanks, everyone. Have a great rest of your day. Stay safe and stay sane.